everyone. Welcome to this week's episode of Dope Black Vet. It is February. It is an exciting month and we're going to be focusing on all things February. First off, Sunday is Valentine's Day, so I wore my red shirt to represent Valentine's Day. I think it's Go Red for Women Month and Heart Health Month, but I'm sure by now you're wondering why is she holding a toothbrush and toothpaste? Well, since you ask, it's because it is Dental Health Month for our pets. At most of your clinics this month, everybody's celebrating Dental Health Month. Many of you may not realize that pets' dental health is super important, just as important as your dental health. So we like to recommend brushing our pets' teeth, and we use a pet-friendly toothpaste so that we can brush their teeth as well. So some of them may or may not like it, but this is one of the things that you can try, especially if you have a puppy. It's a really good time to introduce toothbrushes or finger brushes, or even playing with their mouth and their teeth, not to let them bite, but to teach them to get used to getting an exam, an oral exam, and being able to deal with things when it comes to the doctor and the technicians handling their mouths. So why dental health? If we think about dental health for ourselves, it's just as important in us as it is in our pets. For number one, you think about yourself going to the dentist. They tell us our teeth can lead to other diseases. We can have nasal and sinus issues, and the same thing can happen with our pets. But one of the biggest things to be concerned about with dental health in our pets is their eating behavior. So your pet may be eating less, cats may be growling and scratching at their food bowls. And a lot of these things can be signs of oral or dental pain because sometimes we just fail to look in our pets' mouths. So with this month being Dental Health Month, let this be a month you consider looking in the mouth of your pet to make sure all things look normal. Look at the gum line. Is it red? Is it bleeding? Is there a discharge? Look at the teeth. Are they full of tartar? Are they brown? Are they cracked? Do they tend to bleed? Or they seem to bother the pet? Are they eating all their food? Are they not eating at all? A lot of these can be signs that your pet is having dental problems and needs to see the doctor to have their teeth and gums and their tongue and all those things evaluated. So starting there is one of the biggest things, but also it can affect their heart health. Yeah, it's Heart Health Month for people, but bad teeth and dental disease can cause heart issues in our pets. It can cause a condition called endocarditis, which is inflammation of the areas of the heart. So with that being said, that can cause additional heart issues that may cause your pet to take a trip to the cardiologist, just like for us. So make sure you really pay attention to how often you get your pet's teeth clean. Our dental cleanings in the veterinary world are typically done under anesthesia. Now you think about it, if you've ever had your teeth cleaned before, it's not the most comfortable and most pleasant thing to have done. So there's almost no way we can do these things effectively with our pets awake. Some of you may have explored things like non-anesthetic dental cleanings, which these things do exist, but the pets can't get the dental cleaning that they need and it be as effective when they're awake having their teeth cleaned. Not to mention the number of bites that could take place that could cause a whole nother issue. So make sure that we're paying attention to those things when it comes to our pets' teeth, their tongue, their gum line, their lips, all those things that play a role in how well they can eat, how well they can chew, whether or not they're aggressive because they're in pain, if they're uncomfortable. So if you haven't thought about it this month, if you haven't thought about it last month, let today be the day that you remember to look in your pet's mouth, take them into the veterinarian for a full oral examination to have their teeth checked, their gums checked, to determine whether or not they're a good candidate for having their teeth cleaned. Many of this, like I said, is done under anesthesia, so we're gonna wanna do some blood work before to make sure they're gonna be a good anesthetic candidate and that they'll do potentially well under anesthesia. Some teeth have to be extracted. There are some pets that still have puppy teeth and they're full-grown adults. So all this can be addressed during your oral examinations. So if you do nothing else this month, it's Dental Health Month. Take in your pet to have their teeth checked. Thanks. Until next time, I'm your Dope Black Vet. See you soon. Bye.